My God.
Hey guys, how are you?
Hey, Doc, how are you, Doc?
Looks like we made it. Yeah.
Oh, this is fantastic. Doc, God bless you. First of all, I mean, you're awarded a fellowship in neurosurgical and orthopedic complex spine surgery at the Cleveland Clinic in Cleveland. I mean, you want to talk about doing God's work. Man, you tell us about your career for a second, all right? Because the great people at Rothman, we love our Rothman doctors. We love our partnership with Rothman Orthopaedics. You guys have fixed all of us. He had a broken neck. We have another neck issue with my producer. I had a torn Achilles tendon that was ruptured, and I have a cadaver in my ankle. Like, Rothman is amazing at keeping us in motion. But like when we talk about like your career and the spine, my God, tell us about your career and those kinds of things that you do.
Sure, absolutely. Well, I heard you guys were just talking about St. Joe's Prep, so I'm a St. Joe's Prep grad, so it started there. And then, there we go.
I love it.
And so you know, I started my training in orthopedics at Jefferson at Rothman. Then I went out to Cleveland Clinic, and I fell in love with spine surgery pretty early. I get to help a lot of people in some tough situations, and it's rewarding, it's fun, and I love my job. So it's great.
What I mean, you know, it's funny. Adam Taliaferro, is a dear friend of mine, and you want to talk about, you know, paralyzed and the whole thing, the scary, just the fright that he and his ordeal that he went through. I mean, what's the trick? What's the key to keeping a patient's spirit, right? Like, isn't that part of the healing process? Is making sure their spirit is there?
And that's the hard part, because that you know, patients, you know, they come in and they're terrified once they have these injuries, and it's really kind of counseling their family members on what life, you know, could be like after these kinds of injuries. And then, you know, after surgery, if they need it, after their injury, it's about getting them, you know, into the right rehabs and keeping their spirits up, which is a challenge. And it's a challenge lifelong, right? Because it's something that we kind of counsel them on every time we see them afterwards. We're monitoring for little progress. And anything we can do to keep their spirits up is really crucial.
What are some of the causes, some of the types of causes for them?
So spinal cord injuries, you know, most commonly are from a trauma, right? So it's either car accidents. You know, we're you know, obviously talk a lot about sports. Sports is a fairly rare cause of spinal cord injury. Fairly common cause of neck and back issues, right? We look at, you know, NFL players, collegiate, high school players. A lot of spine injuries will happen, but fortunately, they're not spinal cord injuries where people are talking about paralysis and lifelong changes.
Right.
Although those do happen. But, you know, car accidents and falls are probably the two most common reasons that people have spinal cord injuries in the United States.
Can athletes like typically return to their sport after one of these injuries?
So, you know, there's a wide range of spine issues. And so, you know, a spinal cord injury that results in paralysis or weakness, you know, players are probably not returning, right? But there's a whole spectrum. And, you know, here at Rothman, we take care of a lot of athletes professionally, collegiate, high school athletes. And every year we'll have, you know, especially during football season, people who get, you know, some temporary, you know, stingers in both arms. They'll have some spinal cord or spine issues that develop. And we're able to work them back and usually get most of them back to playing again, you know, after we screen them and make sure it's safe.
What are the like the kind of symptoms and the treatments? Like, how do you treat that kind of injury? I know it's a kind of a big open-ended question, but what is the kind of the treatment? What's the protocol? How do you go about it?
Yeah, so patients who have a spinal cord injury, you know, it really starts with the first responders. You know, somebody, you know, if they're involved in an accident, it's treating their neck or their back appropriately, stabilizing them in the field, you know, wherever the site of the injury is. And then when they come to the hospital, it's getting the imaging that we need. Sometimes we're able to treat them with just, you know, observation and therapy. But if they have compression on the spinal cord, typically we talk about surgery to take the pressure off the spinal cord. And that can involve, you know, rods and screws and plates, or it can involve just taking the pressure off by removing some bone and some ligament. The treatment really varies dramatically depending on
Wow.
what's going on and what we need to do.
What was your most complex procedure that you've ever done?
There's surgeries that we have to do in a trauma situation where we have to kind of go in the front of somebody's neck and in the back of their neck to decompress and stabilize them depending on their fractures, all the way to, we have patients that have developed scoliosis and curves where I have to go in and I have to kind of, break their back and so to speak, or cut wedges into the bone to realign it. So, a lot of complex stuff, but it's fun and rewarding.
God bless you, man. You're a sports guy?
Yeah, of course.
Yeah, what's your
Telco guy? So
yeah, my man. Your family's gonna be so proud of you. God bless you, man. I mean, I think that's amazing. Really, I'm in awe of what you guys do. Who's your squad? You Birds? Go Birds? You 4 for 4?
Oh, Birds, and my wife and I are diehard Phillies fans, so we're at Citizens Bank all the time. So can't get enough of it. My kids love it. So
that's great. Let me ask you a question. How old are you have any boys?
I do. Yeah, I got a 3-year-old.
What would you let your son play football?
Ooh, loaded question in my house. Yeah, yeah, we'll see. He's a big 3-year-old. So right now, I think that's probably the only sport in his future. But we'll see.
You know, it's funny, Doc, because I had that argument in my house, and luckily I won with both my kids. They're 12 and 15, and they're both playing. And I love what the sport does, and you know better than anybody that I think people think youth and even high school. No, there's always a risk for injury, obviously concussion.
Yeah,
but it's not the NFL. Like they're not in
right.
It's the level of speed and the level of physicality is not the NFL. And I think people kind of think that, which kind of makes them afraid of it. And it's a shame because the game is, I just think, such a rewarding game.
Yeah, absolutely. A lot to learn on the field that'll carry them through for the rest of their life.
Yeah, Doc, you're a blast, man. Thank you so
Thanks
much.
A lot.
Love hanging with you, man. You're gonna come in and hang with us one day, all right?
Anytime. You guys let me know.
Thanks,
have a great
buddy.
day.
You too, brother.
All right, thanks.
There he is, Dr. Mangan, Dr. John J. Mangan, doing God's work.